ICICI Lombard presents CNBC TV 18 India Healthcare and Wellness Awards.
Thank you very much. It's a real honor and pleasure to be here. This is my second time in Mumbai. It's an incredible city, an incredible country, and full of amazing opportunity in the today and the near future of health and medicine, which most of you in the room are really helping create. Here's some pictures from my last visit, or my first visit 4 years ago. I still can't figure out how cricket works, so someone can please explain that to me. Tonight I have about 30 minutes to quickly kind of hopefully cover the spectrum of where technology is, where it's heading, and how we can leverage that into the near future of wellness and medicine. And when we think about health, wellness, and medicine, of course, it's an entire spectrum from health and prevention, the wellness side, keeping ourselves, our friends, our family, our patients healthy. There's the diagnostic angle, picking up disease early rather than late. There's therapy, which is hopefully more personalized, less toxic. There's the democratization of healthcare. How do we take it from Mumbai to rural India to rural Africa to rural California and make it lower cost and more accessible? And finally, discovery. How do we all connect the dots and crowdsource information to build the future of health and medicine? I took this picture when I was here last year. Get ready for the future. I mean, there's no better place than India to be creating and catalyzing the future of healthcare. That applies not just here in India, but around the world. And many of you drive hospital systems. You're thinking about what's Hospital 3.0, what's Hospital 4.0, whether you're doing primary care or you're building hospital systems that are focused on medical tourism. And I know many Americans who come here to get better medical care than they get in the States. So amazing work already going on here. But we want to look into the future. Sometimes, though, it's helpful to look back to the future. Some of you remember this movie. We're already 2 years past the date they went into the future, or post-future. I had a chance to go back to the future. I went to medical school at Stanford. I did my medical residency at Mass General Hospital in Boston. We had a reunion for the 200th anniversary of Mass General Hospital. And what was a little challenging is I went to visit the ward where I spent my first month as a young doctor 20 years ago, and in 20 years, it was pretty much frozen in time. Some of the same nurses, maybe some of the same patients. The only difference was the young doctor was typing the medical record, and it was electronic. We used to handwrite it. And the front desk was still using the cutting-edge medical communication tool of our day, at least in the United States, the fax machine, sadly. And my thought was, even at great institutions like Mass General Hospital, and maybe even some of yours, we're still practicing healthcare in old models, waiting an hour in the waiting room to see the doctor for 3 or 4 minutes, whether you're in Mumbai or San Francisco or anywhere around the world. We still practice healthcare in silos, in old ways of thinking. And the opportunity for all of us here is to break open those silos and rethink and reinvent the future of wellness, health, and medicine outside of the usual definitions of body parts. So I'm going to try a little bit of frame setting. Most of how we all practice medicine, including myself, is really on the sick care side of the equation. What we really want to switch to is true health care. What do I mean by sick care? Sick care is our model today. You get little bits of data, usually only when the patient comes to the clinic or the hospital, and occasionally EKG. Maybe if someone has diabetes, they're sending by fax or PDF their blood sugar numbers. So intermittent and episodic data leads to scattered information that lives in different places, and a very reactive sick care system where we wait for the patient to show up in our emergency room with a heart attack or stroke, or I'm an oncologist, a cancer doctor, usually presenting with stage 3 or stage 4 disease. And I would argue for all of us to think about as we move forward is to leverage these new tools that we all have in our pockets and beyond to be more continuous and then much more proactive, and to connect the dots between the engaged patient and caregiver and hospital system and beyond. So it's a real interesting new era. Using that technology, we can address most of the major preventable diseases that we have here in India, from diabetes to hypertension and stroke and beyond. A lot of the opportunities to connect and be more proactive. Even beyond that, we don't want to just prevent disease. We want to optimize our health and wellness, individually and those of our friends and family. That can be through meditation, yoga, exercise, understanding our genomics. All of that can come together in new and powerful ways, not just to live to 120. No one wants to be 120 and not able to think and move and walk and contribute to society. We want health span, not just lifespan. So I'll be focusing on technology, but I think overlying all that, of course, is the incentives. How do we pay for health and medicine? It's different from many of your systems, and it's certainly in the United States, there's many healthcare systems. We need to leverage that technology together with incentives. So instead of being on the right side of the equation, where we do not evidence-based medicine, but reimbursement-based medicine, we can spend more of our health and dollars and focus on prevention, keeping people well, and shifting those incentives. We call that in the United States value-based care in some cases, where we'll only pay for surgeries, hospitals, apps, other things when they work, not just for prescribing them. So combining technology with incentives is critical. Now, of course, along with the incentives, we can change where healthcare happens. No longer just in the emergency room or your intensive care unit or ER. We're going to be increasingly bringing hospital-level care to the home, to our phone, to on and inside our bodies, to our corner pharmacies, which increasingly can provide diagnostics and therapy. And I've been to pharmacies now that have their own integrated diagnostic platforms. Some of them are even happening here in India. You can walk into almost any Indian pharmacy and get almost any drug you want. And I've discovered in many pharmacies here, especially in Asia, you've already discovered the future of medicine. It's called Tiger Balm. So, new discovery for me. All right. So with this new technology, we can leverage the consumer who has more power to compare your hospital to your hospital, your hospital, to compare and rate doctors, to look at individual surgeons and their complication rates. So there's more levels of consumerism and transparency. And a lot of this new ability to find out on your hospital, which hospital to go to on your phone, is riding, of course, fast-paced technologies. Moore's Law, the power of computing getting faster and cheaper. That's an example of an exponential technology. We see that all around us, the price of memory. The fact that my antique, this is an antique iPhone 2, it's 10 years old. It now feels antique. 10 years ago, it was amazing, right? So I want you all to become exponential thinkers as we create the future of medicine together. But it's hard to be exponential. Our minds are wired linearly. I take 30 linear steps, I'll be to the exit sign. But if I take 30 exponential steps, 2, 4, 8, 16, 32, 64, by that 30th step, boom, I'm at 1 billion. That would be 26 times around the planet with that step. That's the power of exponentials that's happening with computing and many other fields. It's often, however, deceptive how quickly things are accelerating. Sometimes they feel not so good, and then 10 months later, AI, VR, genomics is incredibly powerful. So just take a look back. 10, 11 years ago, that was the year the smartphone launched, the iPhone. That's been disruptive. Twitter launched 11 years ago. Facebook came out of universities. Airbnb was still a mattress company. That's what's happened in just a decade. What would the future of health, medicine, wellness, and your hospital systems look like 10 years from now if you think exponentially? Well, part of that, of course, rides our amazing ability to communicate through our smartphone technology. And since I come from Silicon Valley, I have some friends at Apple. I have a secret picture of the iPhone 11. There you go. Don't tweet that out. But these are, of course, becoming medicalized devices where we can democratize healthcare and access and information. And what fit on a desktop computer in 2000 now fits on my Apple Watch. And Apple Watches are becoming diagnostic devices. And now there are computers the size of a grain of rice that have the memory of my Apple Watch, which of course are becoming connected. You know about the Internet of Things. We're quickly moving to the Internet of medical things, Internet of health. And that's not going to be riding 4G pretty soon. It's going to be 5G, which is coming to India in the next couple of years. So tremendous new power to communicate at the digital level. So it's often called now, it's a bit buzzword, right? Connected health, digital health, mobile health. I think soon we'll just call it health. But we can start to connect the dots in all parts of the country and the world and optimize health and medicine for everybody. And of course, it's not just about Moore's Law and computing. It's big data, 3D printing, genomics, virtual reality, converging, super converging. And that's where you need to be thinking if you're going to be on top of your game to create the future of health and medicine and into the future. And address the challenges we have around the world. Rising costs, aging population, access to care. There's a shortage of doctors and nurses in many parts of India. The challenge of too much data. We want information. We don't want data. We want it unfragmented. We don't want to be repeating tests. And the challenge that we have on the right side there, who pays for it? How do we pay for it? How do you set the incentives for the doctor, the nurse, the hospital system? And how do you regulate it? We call it the F word in the United States, the FDA. They're often very linear thinkers. So tremendous opportunity to address challenges, including the big problem of obesity that you have here in India and around the world. Lots of challenges and lots of opportunities, particularly to understand if we treat and manage our children when they're young, giving them, let's say, whole grain foods at 6 months of age, they have a much lower likelihood of developing, through their epigenetics, obesity downstream. So lots of opportunity to address things in new ways. And of course, a lot of that is not high-tech. It's social determinants. It's clean drinking water. It's access to vaccines and social connection that is so important to the majority of healthcare. So while technology plays a role, a lot of these very important factors are underlying all of that. So we all want to reimagine the future of health and medicine together. Often we think about now Uber as an example of disruption, right? They didn't invent the smartphone, GPS, online maps, online payments. They connected the dots in new ways, and it's been disruptive. They're even disrupting themselves with self-driving Ubers. They're, of course, disruptive to the taxi workers here in Mumbai and everywhere else. They're being pushed out of their jobs. That may happen to the future of the radiologist or the cardiologist in some ways. But that doesn't mean we should stop progress from occurring. We need to think of new ways to engage folks. And the implications of self-driving cars alone will make the road safer and have implications for life insurance and disability as well. So lots of downstream elements. But thinking about Uber, we want to Uberize everything, right? We want the ease of pressing a button. This is a new human Uber developed in Japan, provides a way to attend events remotely using another person's body. It's surprisingly natural, says its inventor. So maybe next year's event, you can come by human Uber. But seriously, even Uber themselves is doing Uber Health, where you press a button on the app and a nurse will come to you to give, in this case, a flu shot. Many folks don't have access to getting their vaccinations or have difficulty getting to the clinic. So Uber and Lyft are now providing platforms to help folks get to the clinic in the United States. That could be a way for you to open up markets and bring people to your clinics. And we want the kind of Uberization of everything. There's now apps to press a doctor, to bring a doctor or nurse to you. There are apps for delivering drugs. That's even happening here in India as well. So new ways of ease of connecting the dots to improve care. And, of course, new players are coming in. You all know about Amazon. Amazon is buying pharmacies, very disruptive to the pharmacy business in the United States, could be coming here. You know about their new combination, maybe delivered by drone, their new combination with Berkshire Hathaway. Today, an Indian, I don't know if he was born, but his father was, Atul Gawande, a surgeon out of Harvard, is named the new CEO of this new element. They can connect the dots and align incentives in the U.S. healthcare system, and maybe the lessons will transfer around the world. And even insurance companies are being invented. Oscar Health out of New York, new ways of having user interface. So bottom line, whether it's any form of insurance or new ways to connect and do that in a mobile fashion is disruptive. And we've seen that change the world. General Electric just fell off of the stock market yesterday in terms of the Dow. Kodak, Skype, all these things. Kodak is basically gone. They've been changed. Kodak actually invented digital photography, but they didn't want to cut into their film sales. So as you think about moving to the future, you want to be disrupting yourself. You want to Uber yourself before you get Kodak. And that's happening across many fields. So that's sort of the takeaway in terms of mindset that you may want to have. Now, I'm trained in internal medicine, pediatrics, bone marrow transplantation. I'm a hematologist, oncologist. But I've had a very interesting role over the last 10 years building out the healthcare side of Singularity University, where we bring really smart folks together to look at grand challenges and leverage exponential technologies to help solve them. And about half of the new initiatives and companies have been built at Singularity University come from people outside of traditional medicine. And because healthcare is such a team sport, and many medical conferences are very siloed, I founded a conference called Exponential Medicine, where we bring technologists, nurses, doctors, patients from around the world together to experience the cutting edge and help catalyze the future. But catalyzing the future takes a bit of a new mindset. This is an old quote. The difficulty lies not in the new ideas, but in escaping from the old ones. So what are the old ideas that you're stuck in that may hold you or your organizations back? That's as much as important as the new technology piece. Even the FDA has come to exponential medicine, and now from the lessons there are now regulating software as a medical device in new, smart ways. So come join us this fall in San Diego. All the information is at exponentialmedicine.com. Okay. Let's do a quick dive now into the 4 areas that apply here and around the world and might inform your thinking into the future. First of all, health and prevention. I already mentioned tonight, health and wellness. It's our behaviors, more than our genetics, that impact most of our chronic diseases. So if we can start to understand our risky behaviors and modulate them, we can prevent 80% of probably our healthcare costs. And a lot of that's not that complicated. But we know behavior change is hard. And it's only been in the last 10 years that we can start to track our behaviors. I'm wearing like 5 different versions of trackables right now. Who has a wearable device on right now? Just curious in the room. Any of you? Has anyone ever paid for or prescribed one to a patient? Right? Well, what could we do now with these devices, even in the hospital setting? Someone recovering from a surgery, helping them track their rehabilitation. And they're going well beyond the sensors on our wrist to even sensors in our pills to track when someone's taken their medication. We can measure almost every element of physiology and behavior today using these technologies, not just to track our steps and our sleep, but many other elements that's going to transform wellness and health and diagnostics. And these are shrinking to digital tattoos or shrinking into our hearing aids. And what's important about this is today it's pretty much quantified self. You can have your data on your phone and maybe show it to your doctor on your phone, but where it's going to move is quickly to quantified health, meaning your healthcare system will integrate that data to measure wellness and prevention, to do early diagnosis, and to manage chronic disease from diabetes to cancer. So let me show you a few examples that are already here. Of course, you know, the analog scales become digital. There are next generation scales that will scan your body and give you a lot of data about you or your patient in new digitized forms. We have wearables that are starting to become regular FDA approved that you can use and some insurance companies are paying for. We're seeing ways to track your blood sugar on your smartphone built in with coaching. Hypertension, such a chronic problem here in India and beyond. You can now measure your blood pressure through your watch. Or some new technologies will measure that with radar 24/7 without squeezing anything. So new ways to have a connected data stream. And then, of course, we're going to go beyond the wearables, might be on your foot or your wrist, to the idea of insidables. You know, Google and Big Pharma are developing contact lenses to track blood sugar for diabetics. Or insidables that can go underneath your skin and track data 24/7 and transmit that to anywhere in the world. Very low cost, lots of high fidelity data. So this is not really the future. That's already FDA approved. What about trainables? What if you're trying to change a behavior or a posture? We're in our smartphone here. Our postures often aren't very good. Lower back pain is a very common problem, and a visit to the orthopedic surgeon might require surgery. What if you could put a little sensor on your back? I've got one here. You can buy it on Amazon called the Upright. Put it on your back for just about a week, for about an hour a day, and it'll change your physiology. It gives you a buzz. It's like your digital mother. So when I start to lean over, it measures my bend and gives me a little buzz, and I'll remember to sit up straight. And after about a week of wearing that, my posture's better, and that can maybe treat people with lower back pain. Maybe you need a shockable to get you going. Or hearing devices don't just play music. They're starting to measure heart rate and steps. Ringables. This ring I'm wearing is actually a Fitbit on my finger. It tracks my sleep. Sleep is so important to our chronic health that if we start to understand, here's my data, I might optimize my sleep or my jet lag, as the case may be. And we're learning now to modulate sleep. Apple bought a sleep company. Sleep is a really important element. Now we can do a sleep lab on your ring, pick up sleep apnea, or help someone sleep with the help of a robot. Not for everybody, but that's coming out. What else could you measure that might be surprising? Breath. This is a breathable. It might track how good your breath is if you're going on a date or a social meeting. But we also know that the molecules in our breath can be used to diagnose cancer. Just like a dog can be trained to smell out cancers, we're seeing nano breath detectors being developed that might be the future of screening for cancers and metabolic diseases. Or to measure the health of a foot of a diabetic patient before they get an ulcer and need an amputation. Or many parts of Asia have issues with smog and pollution. Folks can crowdsource the air pollution with wearables and get insights about when to use their inhaler before they might go out. Lots of things we can integrate into our wearable devices and beyond. Even for managing a disease like Parkinson's, you can measure the tremor. The new Apple Watch version will do this very specifically to manage a chronic disease like Parkinson's. We can quantify our food, its calories. Does it have gluten or peanuts? Input we can measure, and we can also measure output, which is really important, and lots of potential proactive health and wellness decisions can be made from that data. Maybe your grandmother had a new hip or knee surgery. They can wear a wearable to help them in the case of a fall. So these are just examples of things that are coming to market. From the pediatric side, we can even measure the health of the mother and their fetus. And when the baby's born, their temperature, how much milk they're drinking. Or now blending artificial intelligence and a camera, we can measure the movement of a child and their heart rate, their respiratory rate, analyze their cry, maybe pick up autism or developmental delay early. So that's a lot of data. And there's even connected diapers that are on the market. That might be too much information for the pediatrician, for the parent, for the payer, all of us. we don't want just data, we want to integrate it. It needs to be smart. We don't want to have 10 wearables, maybe we want one. We want not 10 apps, but one. We want to engage all of our patients to become owners of their health information and to be the CEO of their own health as opposed to waiting for disease to happen and wait for the doctor to take responsibility. And of course, many of you have different markets. A millennial, a young person today who grew up on the internet, has a different way of interacting with their health and telemedicine and chatbots than a baby boomer. So you need to design health with a user interface that matches the age, the culture, the language, of which there's so many across India. So think about the user interface. Now what's interesting today, of course, is that the healthcare, Apple's, Google, Samsung, all getting into healthcare, and they can change incentives. Some of the payers in the room are doing that. You can give a lower premium if folks change their hemoglobin A1C or start to do yoga or meditation. Aetna is paying for Apple Watches if you get your health points done. Mental health is another area we can start to measure and hopefully do a better job with. It's a big problem across Asia, India. Depression and many other elements affect all of us and many of our friends and family. India is pretty far down on the list in terms of overall mental health scores. What can we do with some of these devices in our digital age to predict who's going to get depressed? Or look for the digital breadcrumbs of someone who might be going suicidal? Or how can we use the voice measured on our smartphones or our Amazon Echoes to pick up emotional states? You can even use voice to pick up who is moving into heart disease. So voice is a biomarker. And if we have someone who's depressed, maybe they don't have access to a psychologist or psychiatrist, access is a big issue. Now they can talk to a chatbot and maybe get care. This is Lombard out of Stanford University. Or some pretty advanced versions like this one.
But I try to stay
It's
happy.
watching her eye gaze, her smile level. It interacts and responds appropriately as she needs it.
What advice would you have given yourself 10 or 20 years ago?
So that doesn't replace a psychologist, but can augment them, and is very impactful. So bottom line, we're in this age of quantification. You don't need to wear anything now to measure vital signs. MIT developed a way for Wi-Fi to pick up vital signs of up to 10 people in the same room. So we're entering an age, whether we like it or not, where our digital exhaust can potentially be collected and leveraged. But again, it's a so what if we can just collect the data, if you don't let it flow to your healthcare system, if you don't align incentives for your physicians and nurses to use that information. And part of the workflow, many doctors and nurses are overworked. There's burnout. We don't want more data coming at us. We want we want the dashboard for the patients who need to come in and to highlight that ahead of time. That's starting to happen. Apple HealthKit now can integrate my data through my smartphone, and I can connect that to my doctor at Stanford through HealthKit. So it's starting to happen, this connectivity. But my doctor at Stanford doesn't want to look at my Fitbit data. He doesn't even know what that data means. How do we start to make sense of this digital exhaust? Well, Verily with Duke and Stanford is doing a baseline trial, 10,000 volunteers collecting their digital data, their genomics, their behavioral economics. And the National Institute of Health is doing a Framingham trial for 1 million individuals in the U.S. from different ages and social networks and races. Really going to be very important. And you could be doing that kind of crowdsourced trial here in India as well. Because we don't want what data, we want to be able to predict and prevent and have health and wellness, not disease care. And we need to summarize that, right? Health is not just one score about your steps or your vital signs or your weight. It's your social network strength, your emotional health, your financial health, your sexual health. We can start to score that, just like we do for finance. Even FICO, for making financial decisions, is building a healthcare platform. And as we heard today, ICICI has launched this amazing wellness index, which gives us a baseline to start understanding from different cities and locations and ages how to first measure and then hopefully optimize wellness and prevention and eventually full-on medical care. So there's a power of creating a score and learning how to measure and incentivize. My favorite way of summarizing that is, we're all familiar with our modern cars. Many of them have 300 sensors. You don't know about any one sensor. You don't care about the sensors. You care about when your check engine light goes on. So how could you as hospital systems and innovators build that kind of check engine light for the body? And not just keep that data for yourself, share it. Teslas are now pretty much self-driving. And when the self-driving Tesla learns a dangerous curve, they don't just update their map, they update the maps for all the other Teslas. So the hive mind, how could, across India, data be shared to build high-precision wellness and medical maps? Now, data alone, of course, is not enough. Behavior change, we know, is hard. So we're seeing new ways to do digital coaching. There's Vita.com in the United States. Here in India, Goki, a nice platform for incentives, points, measuring, and coaching. We can see new versions of coaching for pre-diabetics. This is called Omada Health, where we identify pre-diabetics, put them in a social network group, measure, and about 80% turnaround before they ever become diabetic. So powerful models that can be applied here as well. We're seeing chatbots that can track sleep and activity and remind me that I'm jet lagged to get to bed early tonight. These will start to coach our chronic disease. Or when you send someone home and discharge them, you'll send them home with a coach.
Hello.
Some of them will talk to you. They'll look like your nurse or your doctor. And some will be home robotics to help an elderly person remember to take their medication. You don't even need a robot. We have versions of avatars that can show up in your phone that are highly tuned to someone's individual emotional state. They look real, but they're not. And it doesn't matter. They can still engage folks at a certain deep level. And increasingly, we can do that with voice. Amazon Alexa, Google Home. How much insulin should I take after I had that pizza? Google, make my doctor's appointment. Alexa, help, I've fallen, I can't get up. These will be ways that voice is going to be super powerful. So think about building voice into your operating room, your home, your connection for follow-up care. And these will be virtual coaches. You'll talk to your coach. You'll see you of today in the mirror. You of today, hello. But you might also see you of tomorrow when you look in the mirror. That can be a powerful lever for change. If you're doing your exercise, if you're staying on top of your medical plan, you of tomorrow. Or if you keep having donuts for breakfast, you of tomorrow, right? This is a powerful lens for change. Me now, me, after 1,000 donuts. That can be a lever for behavior change. Or if someone's smoking and I can show them what their face will look like from smoking for another 5 years. Very powerful levers. Blended reality. And that also, if you spend too much time on Facebook, what can happen? So that brings up this area of convergence augmented reality. These are my antique Google Glass. They're already 5 or 6 years old. They haven't been a big hit in consumer, but these have been very powerful in the operating room or for surgeons or doctors to see patient data or have someone scribe and type their notes for them. Where's my volunteer? Come on up. We now see HoloLens now being used by Microsoft to use in the medical setting and to train medical students in very smart, engaging ways. So you can democratize access in that way. We are seeing the ability to take a surgeon now, and they can blend data when they're about to do, a spine surgery. They can blend the MRI data, for example, and use that to do a smarter, safer procedure. Using, again, existing MRI data, but layered in with AR and VR, and even be guided by an AI chatbot. Or in the operating room for a neurosurgeon. These is going to be very, very powerful, including for engaging our patients. So here's an example. We're going to do a little checkup on Yeshwant here. I'm going to do a little checkup. Come on. There we go. Got a good view of his insides here. I can see what you had for breakfast. I don't know if you can all see this. I can check into his heart. He's got a very nice heart. Look at his 4 chambers. Pretty good. And that's blended reality. Okay, Yeshwant, you check out. I'll send you the bill later. Thank you. And that, thank you, all set. He's good. So we can engage our children early, right? My son Leo now knows about his basic anatomy when he's 3 years old, right? Very powerful ways of engagement. Or to teach a medical student with a virtual heart on their iPod. I love lessons from aviation, checklists, simulation, but also the idea of augmented reality. We use that in the fighter cockpit to know where the bad guy is. Sometimes the plane will even talk to us if we're about to hit a mountain. Oh, that'll wake you up when you're flying. So what if we took that to the wellness side? You see your breakfast in one way, and you see it in another way, and maybe you get another hint before you eat your breakfast. So new approaches to gamifying health, including social. Games like Pokemon Go. Health is social. Bringing people together and getting activity to happen can be powerful. What about virtual reality? How many people here have tried virtual reality? Not enough of you. Maybe a third. That virtual reality is very, very powerful, right? It's always fun to show people virtual reality for the first time, like Grandma here, put her on a roller coaster, and it feels real, right? But we're now seeing that VR can be used in very low-cost ways. Google Cardboard is like $3. Oculus Go just came out at $200 US. I've got one here if anyone wants to try it. We're seeing that being used for therapy. This is work that's been done at Cedars-Sinai and beyond. You take patients with burn injuries or pain, put them in a cold environment, they use less than half the amount of pain medication. We're seeing VR being used for physical therapy to get people engaged and have better outcomes after, let's say, a shoulder surgery. We're seeing being used in hospital settings to unstress people. They can go to the beach before their surgery or on their post-op care if they're isolated in a bone marrow transplant unit. So very powerful ways to potentially better outcomes or do guided meditation on an airplane. So powerful new ways we'll use VR also to educate our doctors, our nurses, our patients. If you have a patient with a complicated heart issue, they can then walk inside their heart. Or the surgeon can go inside the heart before they do that procedure. This is going to change not just medical education, but education in general. And that can democratize medical education anywhere. There's a shortage of surgeons here in India and many parts of the world. My friend Shafi Ahmed in London is the pioneering sort of virtual surgeon. I was in London 2 years ago. They did the first live stream VR surgery. 5,000 medical students around the world were watching a surgery in real time. How could you leverage that in your clinics and beyond to educate and bring people out of the operating room to learn, for example? He was even using Snapchat now to record surgery. So you can take consumer devices and use that for education.
Scrotum and the
Finally, where this heads is the idea of sort of see one, do one, teach one, how we missed many of our doctors here got trained. See one, do one, teach one. The future will be see one and simulate it. So you have a difficult, challenging case, let's say an orthopedic fracture you've never seen before, you go into the virtual operating room. You have the actual medical instruments there for that case, the actual virtual fracture. You practice the entire procedure, maybe multiple times until you get it right, and then you go in and do the procedure. So this is already being built and is going to be, I think, part of the future of medical education and continuing medical education. What about other elements we can bring to health, medicine, and therapy? Genomics. I'm not sure who's been sequenced here. Anybody got your genomics done? A few of you? Right, the price of sequencing is dropping at twice the rate of Moore's Law to about $100 US. Soon it will be $10 US. How do you take genomics, like consumer genomics, and you have versions here, and bring that to the clinical setting? Well, for example, here's my data. I can see my risk of type 2 diabetes or chronic kidney disease. And what if my doctor could see that, or my healthcare insurance system, and use that in smart ways? I can look at my responses to drugs, pharmacogenomics. Which statin would you prescribe? What beta blocker is going to work? There are now app stores for your genome called Helix. This just launched last year. There are apps, for example, that look at athletic ability. This is my data. I'm always a pretty fast runner. My metabolic efficiency is high. I'm very bad at long distance, cross country. My endurance genes are low at 34, and I want to get up and do my exercise in the morning, but I usually have trouble getting out of bed. I can blame my parents. As you see on the left, my motivation genes are low. Yeah. So I need a time check, by the way. There's no time check, so let me know when I have like 5 minutes left. Thanks. And there's even genetics that can check what kind of wine you might like. Or I just had my genome done and had socks made that are very specific to my personal genome. So fun ways to engage in that. But it gets really important when we could use that for diseases like type 2 diabetes. It's not one disease. In this case, there are at least 3 different subtypes identified with machine learning and AI and thousands of genomes. So what if you could use that to analyze every type 2 diabetic and treat them in a smarter, more personalized way? Beyond the genome, we're in the era of the microbiome, the bugs in our gut, impact our risk for heart disease, for obesity, for inflammatory bowel disease, for Parkinson's. You can all get your own microbiome done for about $50 US today, and maybe use that to tune therapy. Many of you may have even tried fecal transplants. 7,000, I think, Americans die every year from C. diff infections that don't respond to vancomycin. Now, fecal transplants can save them. Or maybe we'll do a fecal transplant for someone with inflammatory bowel disease. Or use our microbiome and genomic information to tune our diets. You're trying to get someone to lose weight or turn around from being diabetic? Don't give them the same diet. Use their genomics, their microbiome, their blood sugar data, and even deliver to them their own personalized meals. So lots of things are coming together in that space. And of course, we're in India, the home of meditation, yoga, ancient technologies can be leveraged in very smart ways. Everything from VR-based yoga. I did my yoga today. It was called Shavasana for 10 minutes. That was my only pose. And look at their effects on our brain. And many folks have difficulty getting into meditation, so I can prescribe them a brain-computer interface, a consumer device to help them learn to do mindfulness training, helping with stress or anxiety or depression. Or using this for children who have ADHD and have trouble focusing. They can learn to focus with a brain-computer interface. And these are now being used in video games that are becoming FDA approved. So we may be paying for and prescribing video games that engage our patients and help their brains if they have everything from a dementia to just trying to improve your own cognition. So these are going through the FDA now. Will be a whole new set of tools. All right, last couple of minutes. Diagnostics. We need to diagnose hopefully early rather than late. Diseases like Alzheimer's can be picked up by brain scan or blood tests or eye tracking devices. Maybe we can prescribe a statin for the brain before someone gets Alzheimer's, even if they're at risk. We can now use an entire laboratory on a chip. Many parts of India don't have a centralized lab. You can now do a laboratory on a chip. Use your smartphone to basically do the analysis and communication. And there are many important examples. As we talked about earlier, you can get an antibiotic without a prescription here that kills many folks or creates drug-resistant bacteria to tuberculosis. There's technology, for example, this one out of Israel, using blood or sputum in 10 minutes by looking at immunologic markers can tell bacteria or virus. What if that became standard of care at low cost anywhere in the country? And of course, we now have a whole new set of digital tools. And just a few examples. A smartphone app can now track hemoglobin, useful in many populations. We can use, instead of a Holter monitor, a simple patch and drop it in the mail to diagnose a heart failure patient. We can have a digital pill cam to swallow instead of doing an expensive GI exam. Think of all the exponential technologies in this robotic pill that can do diagnostics and maybe therapy. If you have a nurse in a rural village, maybe an obstetrician, she can now use AI-guided ultrasound on a smart tablet to do a follow-up exam. Lots of new powerful ways to upskill a nurse or even an untrained person in a rural issue. We talked about the check engine light. We talked about the Apple Watch. These are becoming diagnostic devices. Here's an example from earlier this year. This patient tweeted this out. Never thought a stupid little wrist computer I bought 2 years ago would save my life. Saw my heart rate go up, ended up being a pulmonary embolism. That was basically his watch telling him, you shouldn't have a heart rate of 200. And maybe the future will be the Uber will arrive for you and take you to the right hospital, which has the open spot in the waiting room. We can do a virtual ear exam and help kids or parents who don't have access to a pediatrician, or hopefully pay that pediatrician to do a virtual ear exam. You need to align the incentives for your physicians to do virtual exams and provide them the tools to do that. Or let them use the smartphone to diagnose a pneumonia without having to come into the clinic. Lots of new tools exist. This is not new technology. You have the ability to integrate that. And of course, the number one killer here in India is still cardiovascular disease. So you can have essentially an EKG on your phone with the AliveCore EKG device. This is FDA approved. The new version actually is on my watch. It uses AI to do my EKG analysis. You could give this today to a patient with atrial fibrillation and save many hospitalizations potentially. And there are also now patches that have just been developed that are essentially an intensive care unit on a patch. So you could use these on a step-down unit or send someone home a day or two early, tracking EKG, temperature, heart rate, falls. All of this, again, exists. How do you connect the dots? How do we pay for it? How do you leverage that across the amazing market here? And let's say you do have a patient with heart disease. Do you do an old-fashioned angiogram? No, now you can do a virtual angiogram, a 30-second CT scan, measure how narrow the blood vessel might be. Computationally, does that patient need a bypass surgery? Do they need a stent? What kind of stent? Maybe we'll 3D print the stent to match that patient's anatomy. So lots of powerful ways this is going to move forward. And the future's coming, right? Star Trek, the medical tricorder. I helped design a medical tricorder X Prize. About 400 teams enter this competition to make a home-based diagnostic device that could do better triage. The finalists were announced last year. One of the finalists was a device like this. You hold it to your forehead, pulls down temperature, heart rate, oxygen saturation, talks to IBM Watson on your smartphone. They also developed a smart way of, that's the data. They also developed a smart way of doing urinalysis. So instead of going to the clinic with your urine, you dip your urine dipstick, take a picture with your phone, and you get an AI-developed urinalysis sent to you and your doctor and maybe the pharmacy immediately. So that's not science fiction. That's been built. How do we integrate that in? And finally, I'm now leading up a new cancer X Prize. Many folks in India don't have access to colonoscopy or mammography, other screening. So we're launching a new X Prize later this year, early next, to incentivize teams to build rapid, accurate, and affordable ways for screening and detecting multiple cancers. Imagine that being as easy and cheap and available as a urine dipstick for pregnancy. So would love any of your hospital systems here to help support and maybe form teams and share data for that X Prize, xprize.org/cancer. All right, we've talked about a lot of data. It's a bit overwhelming. There's no way that a doctor or pharmacist can keep up today. We need new tools to enhance our brains so that Dr. You can be you or your patient. And again, we've already talked about lots of new data sources. Many of them are less and less expensive. We need to connect the dots and make that useful. And of course, you've heard about AI. It's exploding potentially in healthcare. I like to think of it not as AI, but IA, intelligence augmentation, so that we can augment the clinician, the nurse, the patient, the healthcare system. And here's some examples of what's already available. A skin exam. Yeah, you can take a picture today, send it to a dermatologist, but now we can already tell from your app on your phone if that's a melanoma or a mole. What's the future of the dermatologist when that's possible? It really is already today. You can try it out yourself at First Derm. Ramesh Raskar, MIT professor, developed new mobile ways of doing eye exams, and now Google and DeepMind can look at the retina and predict who's likely to progress with their diabetic retinopathy. And then published 2 months ago, they can tell just from the retinal exam, age, sex, BMI, and who's likely to have a heart attack or stroke. And I know you have your new identification system using the retina. What if every time you checked your ID, you were getting a retinal scan and it gave you proactive health and diagnostic information? The digital pathologist is coming along very quickly. The digital radiologist is already better than Stanford radiologists. So these won't replace radiologists, dermatologists, pathologists. Don't worry about that. It's going to augment them or give access to that kind of diagnostics anywhere. So not robots and AI replacing doctors, nurses. We need to have more human touch, more time for the technology to get out of the way and blend what humans can do well with the human touch and the combination of machines. Okay, last minute, because I think I'm late. Therapy. We all want new ways of doing therapy. I think you're all familiar with CRISPR, which is moving quickly. It might cure diseases like sickle cell, thalassemia, even HIV. We're seeing new ways to do non-invasive surgery, MRI, guided focused ultrasound, the ability to knock out uterine fibroids or metastases in the lung or inoperable liver tumors. That's moving through the FDA and beyond. New ways to track drug delivery. We know that many drugs aren't taken as prescribed. We can now digitally connect. There's even pills now on the market with Otsuka that can tell when you took the medication or not, and that's going to expand. We're beyond the pill. There's the prescribing pacemaker, not just for the heart, but for the brain, for the gut, for obesity. There are digiceuticals for treating sleep apnea, or digiceuticals for contraception. They come with remote control. So, honey, where's the remote? Or what if someone hacks your remote, or hacks your pacemaker, or hacks your medical record, or hacks your hospital? I hope you're all paying attention to medical records and privacy, and hopefully leveraging new technologies like blockchain to help solve that issue. Big challenges, but doesn't mean we should be afraid of sharing data. And then, of course, we're moving to this disruptive era of digital digiceuticals, prescribing an app with a drug. We've seen at the Mayo Clinic with heart failure that sending someone home with an app and a wearable and a connected scale reduces readmissions by 30-40%. We're seeing digital checkups become the norm, where you can, again, use the devices in my pockets or home-based diagnostic platforms that can, again, bring to a rural clinic or a hospital or a school, anywhere, the ability to do smart diagnostics, bring in a physician if you need to, and then connect you to advanced help if that's necessary as well. Chatbots are here. Many of you use chatbots. Those won't replace the doctor or the nurse, but can be the first layer, or for someone who has no access to a physician, give insights and information. So think about the future of telehealth. How do you layer that into your practice today? Don't be disrupted by it. Start to put it together in interesting ways. In China, over the last 3 years, Good Doctor already has like 190 million users. What will be the Indian version of Good Doctor as you move forward? So lots of ways telehealth will expand, and virtual visits will become almost real. Last 2 points, I hope. 3D printing. Another interesting area. I can now print, for example, I can print myself. Here's mini me. It's kind of cute. I can carry him around. But you can 3D print a cast that matches someone's exact fracture and even monitor it digitally. You can print hip implants and knee implants, maybe eventually in the operating room in real time. One of our Singularity University companies built and flew the first 3D printer to the space station. And they've now started printing medical devices on the space station, like medical surgical devices or a splint for an astronaut. So think about printing a medical device anywhere in India when you need it for pennies. Even printing drugs. Printing organs, I think, is a little farther off. It's a kind of an interesting area, not quite ready for human use. I think what will disrupt this is the ability now to take genomics, CRISPR, for example, and humanize pigs and make their organs human enough and less pig-like. It won't be kosher, but you'll take that organ for your patient who needs a heart, a liver, a kidney transplant, given the organ shortage. And that's moving along very, very quickly. I think we'll be in the clinic in 3 or 4 years. So watch that space. All right. To pull this all together, particularly relevant to India, how do we democratize healthcare with these tools, right? The Internet of Medical Things can be picking up dengue fever proactively based on reports from cell phones or rural clinics, kind of crowdsourcing information about pandemics before they become pandemics. We can now see that Project Loon and Internet access is going to come and provide access to information in rural Africa or to many elements and areas of clinics in India, which can now have access to high-speed bandwidth. 3 billion individuals will be coming online around the planet in the next 3 to 4 years. And then you can even deliver their drugs and vaccines by drone. This is one of our early SU companies, a drone that will deliver drugs and vaccines. In fact, in Rwanda now, there are 1,000 clinics that are getting blood and other diagnostics delivered by drone within 10 minutes. So new ways of delivering with low-cost drone technology that's advancing exponentially. Drones for defibrillators, or certainly with the traffic here in Mumbai, you may want a drone ambulance. That'll get you where you're going. All right. My final point is we all want to be creating the future together. Healthcare, medicine, wellness is a team sport. You can now download a clinical trial, build one yourself, use sensors, use ResearchKit, build your own clinical trials for your own markets, like the My Heart trial at Stanford is already accumulated thousands of patients in the first few weeks. And I think the future of healthcare could be as different as driving is in 10 years. 10 years ago, we still drove with paper maps. Remember that? Now you couldn't imagine driving without Google Maps or Waze. Could you, right? And that's crowdsourcing your private data, your speed and location. In exchange, you get a map of the traffic. What if we had a healthcare map? What if we were all building that map of Mumbai and the rest of India together, crowdsourcing the pathways to health? So thinking ourselves not as organ and blood donors, but data donors. And we're all about kind of a medical share button available in all of our hospital and medical records as those become connected. So I've thrown a lot at you, right? Lots of technologies are crossing. It's no one technology that's going to create the future of health and medicine. It's this convergence. There's amazing Indian technology, entrepreneurs, mindset that you all have to take these exponential technologies, put them together, and don't think about where the technology is today in 2018. Be like that famous Canadian hockey player, Wayne Gretzky. Skate not to where the puck is today, but where it's going to be in 2020 with AI, genomics, 3D printing, nanotech, drones. And if you have that exponential convergent mindset, together in India and beyond, we can move from episodic and reactive and siloed sick care to a future of health and wellness that's continuous, proactive, and participatory. And again, the future's already here. A lot of this technology, many of you have already built. It's in my pockets. It's in some of your watches. We all have the opportunity not to take linear steps, but exponential steps. And all of us, particularly the amazing competitors and winners and prize winners tonight, have the ability to really build and create, not predict, but build boldly the future of health and wellness and medicine in India and beyond. So with that, thank you very much.
ICICI Lombard presents CNBC TV 18 India Healthcare and Wellness Awards.